Hello, hello, viewers at home. Thank you so much for joining us this afternoon. Um, I have a guest in the house today, um, Dr. Abayomi Ajigini, and today we are going to be talking about a topic that is very, very dear to my heart. And our health is very, just a moment, please. There's a general saying that says that without health, really, there's really no life. Let's put it that way. No matter how wealthy you are or how comfortable you are, if your health is not in good state, you will be limited by the things that you can achieve here on earth. And we are in the age of information. There's so much information out there now that really there is really no excuse for anyone out there not to take advantage of loads of information out there, for us to use and especially take advantage and look after our health. And this afternoon, we're going to be focusing on one of the health conditions that seems to be incapacitating men and women. And it seems to be on the increase. And there's a need for us to really slow down and find out why and learn the things that we can learn to help us to live better. It's no more about how many years now, it's about the quality of life. So even if you live till 60, 70, 80, and you spend greater part of your time managing health challenge that is avoidable, you will agree with me that one way or the other, it will impair the quality of your life. And I have learned that prevention is better than cure. There are things that we can put in place that can help us to move away from path that can open us up to health challenges. Mr. Bayo, you're welcome. That is our fitness guru.
I try my best, like you.
That is our fitness guru. I call him my mentor when it comes to fitness. Okay. So we are starting out, and I'm just going to do a brief introduction about our main speaker today, Dr. Abayomi Ajigini.
Yes, sir.
Dr. Abayomi Ajigini, popularly called Dr. Achi, obtained
Ajigini.
his primary medical qualification, MBBS, from the University of Lagos in Nigeria, and subsequently trained as a surgeon in UK, obtaining the fellowship of the Royal College of Surgeons of Edinburgh. After obtaining MBA from the University of Surrey in 2006, with a focus on healthcare management, he decided to train as a general practitioner and obtain the membership of the Royal Colleges of General Practitioners in 2011. He is currently working as a freelance GP in Kent while studying for a Master of Sports Science degree from the University of Bath. He is passionate about promoting good health and well-being, especially among the Black and minority ethnic groups in South East London. He currently heads the medical team of a Christian charitable organization, Christ Faith Tabernacle International, and has organized various outreach programs in conjunction with the Royal Borough of Greenwich Public Health Team, Prostate Cancer UK, Cancer Research UK, British Heart Foundation, and Sickle Cell Society. Let's put our hands together as we welcome Dr. Abayomi Ajigini. Okay, so over to you, Doctor. All right. So let's have Dr. Abayomi now.
Just give me 2 seconds. I'm just going to go into, first of all, let me just say thank you. Most people call her Olalonke. I know her as Tokumbo. Part of the profile that we don't talk about was we grew up together when we were both little. And when you have one young girl on the street that you really want to keep knocking her head, that's that's Tokumbo for you. And then she went to the same secondary school with my girl, that's my wife I'm talking about, and the same university also. And as time and chance we have it, here we are again working together to present a topic, which with the aim of bettering the lives of our people. She talks about my passion of, promoting healthcare. I mean, I have two passions, kind of playing golf and also promoting healthcare. And I was meant to be playing golf today, but when Tokumbo came and said, Yomi, are you free can you do this today? I was like, yes, I will sacrifice my golf for that, because what she's been doing and what she's doing is quite commendable. And I really, really appreciate you for that. And also what Bio Ultra Spirit Runner is also doing, it's quite commendable. And it's nice to have both of you on, and then as many other viewers. The thing about Zoom presentation is that sometimes you don't get to see everybody and you don't know if someone is there. But I know by the end of this presentation, with your questions and everything, I will know that, some people are there listening, and I hope that, okay, fine, I will have made you, given you some answers and to your questions. So we're going to be talking about hypertension, or the specific topic is living beyond hypertension. So I'll try and share my screen now, so that at least you can see where we are. Cool. Okay. Let's go back a slide. Okay. So the topic is living beyond hypertension. I mean, I put that picture there of a blood pressure monitoring machine. It's quite a cheap machine or instrument to buy. So you can always go to any pharmacy, Amazon, or online, and buy one for yourself. Once you are above a certain age, maybe 40 years old, in a Black and minority ethnic group, or of any ethnic group at all, you should ideally have one of those machines in your house, just to monitor your blood pressure now and then, so that you can have an informed discussion with your GP, or you can have an informed life. Because as our host was saying before, we don't have to have these health challenges when we can prevent them. So there will be issues that will lead to you being able to prevent them. And that figure over there, 158 over 99 or 159 over 99, is the cutoff of what we call stage 1 hypertension. I will get to that later, so let's go ahead. I said hypertension. If you stop a layman on the street, and say, what is hypertension? They all know, and we all know, it's elevated blood pressure. And I can bet that, we all on this forum have one or more relatives that have had issues with elevated blood pressure, But when we doctors and our talk this afternoon is going to be focused mainly on what we call specifically persistently raised blood pressure within the arteries. In the heart or in the body, you have the big machine called the heart, which pumps blood, and the arteries take the blood from the heart onto other parts of the body to supply nutrients and energy for the body to function, while the other big veins or big vessels called the veins bring the blood back to the heart. If the blood pressure within the arteries are elevated, then the heart has a challenge of pumping blood pressure or blood against this high pressure. And if it become sustainably high or persistently high, then the work of the heart is doubled and it's made more difficult for it. And you can imagine the heart that still have to work for 80, 90 years, if God permits. And if you start tasking it from the age of 40, then something happens. We come to the reason why it is called a silent killer. It's because during the process, right from the time the blood pressure inside the arteries are high, initially the heart will be pumping against this blood pressure and will be trying to do its work. But the more of the pressure that the heart has to overcome, the more difficult it gradually becomes for the heart to be able to do the work. And then gradually the heart starts tiring out. Not only will the heart tire out, the other parts of the body that this blood is meant to get to in order to provide what we call metabolic function, they start lacking in the blood and the supply because the pressure and the narrowing of the arteries makes it that they don't get enough blood circulating to them. And you might not feel anything. The patient might not feel anything. The person might not feel anything, until, they get into a situation whereby something else happens. And that's when they will start knowing that, oh, it is because of the blood pressure. We get to that in a minute. And when Tokumbo was talking earlier on, she was talking about it's continuing to increase, and that's the truth. It's estimated that in 2025, there will be at least 30% of people worldwide with grade 2 high blood pressure. But currently in UK, 1 in 3 men and 1 in 4 women suffers with high blood pressure that needs treatment. Clinically, they need to be managed. So that shows the preponderance and the commonality of it. I was talking a bit, when I was talking about it being a silent killer, that you might not have any symptoms, but then all of a sudden, what you experience will be its effect on what we call your general body. You just feel tired, lack energy, you don't know what's going on. And it's just because there is no blood getting to your organs to function. And I'll just show, this gentleman here, it's just kind of a pictorial depiction of the areas in the body that are actually, shall I say, vital, and they are affected a lot with high blood pressure. When the blood pressure is very high in the, or the pressure in the arteries are quite high, the brain, the eyes, the heart, and the kidneys, they have what we call end arteries. These are vital organs in their function, but the arteries, the blood vessels that goes to them, they are tiny, they are end arteries. And if the blood or the pressure in the proxima, that's before you get to those end arteries, if the pressure is quite high, then those end arteries don't get enough blood circulating to them. So the brain don't get enough blood, the eyes don't get enough blood, the heart itself, has to be supplied by the blood vessels, and the heart itself also does not get enough blood. And the kidney, what we call the renal, the kidneys, they have a kind of a dubious position in that they maintain a case of a chicken and egg situation. We don't know whether it's hypertension or high blood pressure that causes kidneys damage, or kidneys damage leads to high blood pressure. but we do know because the kidney is quite important in the process of maintaining the blood pressure in the body. The full details of that, I don't think it would be should I say, appropriate for this forum, except if someone wants to know, you can ask it in the question and I will address that. So all of a sudden, the person can just present with a stroke. I'm sure we've all had people that presented with a stroke. All of a sudden, we just go, oh, he looks like he's an active young man. What happened to him? Or what happened to her? And he said, oh, he just slept and woke up and the hand is, cannot move the hand. Or if it's like sitting in front of somebody, the face just drool, the typical fast where, okay, the face drool on one side, the speech becomes muffled over, and the face is dropped and they cannot lift their arm. When you see that, we say, call 999. It's the typical fast for stroke. Some people, it is in their sleep, they develop their own stroke. The eyes, after a certain age, some people have to wear glasses. That is just normal with the eyes adaptation. But apart from that, the back of the eye, where these end arteries are, the blood, because of the high pressure there, and these arteries there, they got thin walls, you start leaking blood to the back of the eye. You can't see it, because unless you go to the optician before, when they put in the ophthalmoscope, before they can see the back of your eye, but you can't see it. So you don't know that there is a problem there, apart from people start getting, degeneration in their eyesight. And when that starts happening, you should go and see your doctor. Of course, the kidney I've mentioned and the heart itself. All of a sudden, they just clutch their, they clunk their heart while they are walking on the street, or they try to do some exercise and all of a sudden they keel over, and sometimes the heart itself cannot pump anymore because it needs this blood supply to be able to function properly, but it's not getting it. So it's going to be, so the presentation of hypertension can be those, what we call the complications of raised blood pressure in the arteries, rather than, so that's why it's referred to a silent killer, and where you just have general symptoms and nobody really, can say. So what causes high blood pressure? There are numerous causes of high blood pressure, and I might not be able to go into all of them, but we do have what we call primary hypertension or high blood pressure, where it's just constitutional. If you are a man, and as you see, when I show 1 in 3 and 1 in 4 women, men are more predisposed to developing high blood pressure. If you are of my color or my background, Afro-Caribbean, we are more disposed to developing high blood pressure. Sometimes when you get after a certain age, we don't expect high blood pressure, although it still happens in people under 40, but above 40, a lot of people start getting high blood pressure. So those are the kind of situations where we say they are primary causes of high blood pressure, which you cannot really modify, or what we also call non-modifiable causes. You cannot really change them. They are who you are, basically, and also the genetics or familial aspect of it, whereby somebody in your family, has your parents or anybody there, if they have high blood pressure, diabetes, cholesterol problems, these all 3 of them work together. And if you have something like that, or you have a twin brother, twin sister that's got high blood pressure, you need to be careful because you are predisposed to getting high blood pressure also. Yes, some lifestyles, they predispose to developing high blood pressure. Of chief amongst them is what we call sedentary lifestyle. no exercise, you just sit down like Homer Simpson. All your exercise is using your hand to put beer to the mouth and take the remote control and just change the channel while you just sit down watching TV, and match, and they all bring your food to you where you are sitting. You sit, you eat, you go to bed from where you are sitting. So sedentary lifestyle, smoking, drinking alcohol, poor diet, they all contribute to the lifestyle predisposition, to developing high blood pressure. And of course, the renal, that's the kidney. I talked about it, the situation of, chicken and egg. The kidneys might lead, if there's any disease in the kidney, it might cause high blood pressure, while high blood pressure also might cause disease of the kidney. And we do have hormones, both male and female hormones, which are chemicals in the body that helps us to do other things. But if they are not balanced, some of them do lead to high blood pressure. We have quite various ones, Cushing's, we have a problem with thyroid management, problem with renal, and also what we call pre-renal or pararenal glands, which are all in the body. And one of the other things also stress. I mean, for the past 2 years, the world has been largely under stress, from COVID-19. And this has increased, significantly people that are developing high blood pressure, because most of the time that people have stress, maybe they get into a situation that just expose them to stress for a few weeks, months, and and that situation gets dealt with, and that's it. But for the world, last 2 years, you have consistent barrage of not being able to go out, not knowing what's happening to someone, not knowing what's going to happen tomorrow because of COVID-19. And some people now sit down and they just go thinking, and say, oh no, what's going to happen? What am I going to do? What's not going to happen? And gradually their blood pressure just creeps up, and sometimes they are not able to come into the surgery to see the doctor, so they sit down at home with increased stress, increased worrying, and that just kind of build up the blood pressure. And there are life situations also that happen to people, and that causes their blood pressure to go up, and those are some of the things to mention. Okay, now, as we said, how do we diagnose it? How do we come to say, oh, okay, this person has high blood pressure? We've already talked about it being silent, so complication might be what announces it. You might just go to your doctors for a routine checkup. I mean, in this country, it is advisable. If you are someone of Black minority ethnic group, when you turn to 35, 40, I advise my patient, just make a phone call to your doctor and say, please, can I have a checkup of my life? And a few years ago, the government also was promoting everybody above 40, they get letter from their doctors or from the NHS, okay, just over 40 life check, So from there, they might pick up, issues with high blood pressure. And I'll talk a bit about how we actually diagnose it if we just pick it, because usually not only one recording, of the blood pressure that we say, oh, you have a hypertension. Although if we get a recording of a certain level, we know, but most people will be fine. The clinical effects, which is part of the complication. And then you do all these tests, chest x-ray, electrocardiogram, your GP will order some bloods or heart scan. The basic reason for doing all those tests, irrespective of what the blood pressures are, is because you want to know whether there is what we call target organ damage. So we want to know whether there is damage to those organs because of the elevated blood pressure, because that will guide us in the management. Because there are some levels of the blood pressure that if there is no target organ damage, you don't necessarily have to go on medications. We can always encourage lifestyle and everything. But if there is a target organ damage, as shown by your chest x-ray, the ECG, the blood tests, or the heart scan, then we have to institute some medication as part of treatment. Now, the values, that are important and are critical, they keep changing. And recently, by 2019, the values have been updated again. So that's why sometimes it's always better to go to your GP, or get checked up. I put what is normal, 90/60 to 139/89. Most of us, we will have heard of, oh, my blood pressure is 120/80, so I'm fine. Yes, we can, if anybody has a blood pressure of 120/80, we can say they are fine. But if you are a young person, a blood pressure of 120/80 might not actually be fine for you. So we tend to have a range of blood pressure that we tend to define as normal. It's quite a wide range when we say 90/60 to 139/89. Those values might not mean anything, but what it just means is 90, or the top values, is what we call the systolic value, where the heart is contracting at that time. So those values are usually higher. And the lower values, what we call the diastolic values, they are when the heart relaxes to allow blood to come into it. So they are supposed to be lower than the the upper values. And when we're talking about these values again, we say, okay, yes, things are not absolute. And we then have the stages of high blood pressure. Stage 1, if the blood pressure is between 140/90 to 159/99, is now defined as stage 1 by NICE. And let me just quickly say, before, we used to believe that the lower value, that's the diastolic value, was more important than the upper value. Nowadays, both of them are of equal importance. What we call systolic hypertension is as equal as diastolic hypertension nowadays, because sustained systolic high blood pressure, while it is affected by quite a lot of things, emotion, the way you are, sleep, and all those things. But if it becomes sustainably or sustained, in a high level, then it starts causing issues for the heart, because the heart now has to pump against such a high sustained blood pressure. So that's why we say both values are now of importance. And NICE just means National Institute of Clinical Excellence and Healthcare. There is a regulatory body in UK. Other countries might have such a regulatory body that determines or that gives advice about what is the right way to manage situations, or what should be their advice and guidance that the doctors are in UK advised to follow. But they are not usually an advice that you can refuse, or else you must have a very, very strong reasons to refuse, and not follow those advices. So basically, stage 1, we call it blood pressure that is recorded in the GP surgery of 140/90 to 159/99. So if a patient comes into the GP surgery and the nurse or the doctor records a blood pressure of 140/90 to 159/99, you wait, you take 2 other readings during that time. And if it still stays within that range, you start thinking, okay, it's possible this person has high blood pressure. You might not want to do anything straight away with stage 1, apart from other the tests that we've discussed earlier on, the chest X-ray, ECG, blood, and all those things. And if it's possible for the person to have a blood pressure measuring machine at home, then the person can be advised to do what we call HBPM, which is home blood pressure monitor. Which the way we advise that is to say, when you wake up in the morning, before you get out of your bed, do 2 blood pressure readings, 1 minute apart. And last thing at night, when you finish everything you are doing and you are sitting down for 20-30 minutes relaxing, then do 2 readings, 1 to 2 minutes apart. Do about 4 or 5 days of the week of such reading and bring it to the surgery. Then the GP and the nurses will have about 20 readings to look at. And from those readings, they can then make a decision jointly with you, what is the best line or best way to go. If it happens that the person does not have a machine at home, then you can send them to the local health center or anywhere where they get what we call ambulatory blood pressure monitor, ABPM. They have a machine attached to them for the whole day, and that records their blood pressure for the day. You will see that the values on those ones, it's lesser than the values that you record in the clinic. Because when you come to the clinic, sometimes we think, okay, the values might be a bit high because people don't like going to the doctors and it's an artificial setting. Basically, it's not their usual lifestyle. So, but if with the home blood pressure measurement or the ambulatory blood pressure measurement, the values are 135/85 to 149/94. We say there is stage 1 hypertension. Okay, so we go to stage 2, which is similar to what I've just explained, but a higher value, 160/100 to 180/120, or 150/95 if you do the home monitoring. Stage 3, anything or anyone in stage 3, you don't really have to do any other tests. You don't have to be waiting for any other test, because any blood pressure that is greater than 180/120, the person runs the risk of leaving your surgery and having a stroke or having a heart attack or having a bleed into their eyes. So anyone that comes to the surgery and the blood pressure measurement is more than 180/120, we say they have severe hypertension. And if it's one that's risen all of a sudden, we call it malignant hypertension. And sometimes we have to send them to the hospital if they don't want, if we are not able to start them on medication. You have to send them to the hospital so that they can help to gradually bring those blood pressure down, because they run the risk of having complications. Okay. Now, we said, the topic of today is living after hypertension. So it's not all doom and gloom when someone is diagnosed as having high blood pressure, but the talk or the discussion had to be done or had between the patients or their families and the doctor to treat or not to treat. As I said earlier on, stage 1 and stage 2, you can still play around and say, okay, I might not treat with medication, especially if there is no end organ damage. So if they don't have a problem with their kidneys, their heart, their brain, and their eyes, you don't have to use medications for the stage 1, stage 2, but they have to institute lifestyle changes and everything while you keep monitoring the blood pressure. And sometimes they have to come back, depending on what their lifestyle and everything is, they have to come back in 2 months or 3 months to check it. And if they've been able to institute lifestyle changes, we get to that in a few minutes, and the blood pressure is coming down, then you can say, yeah, okay, let's keep watching and not start any treatment. But if they have not been able to, or they will not be able to do that, then you will need to start treatment, especially if there is a secondary or what we call target organ damage. When you do your blood test, ECG, chest x-ray. So how do we manage? Medications. I'm a doctor, so medication is chief of what we do. When the lifestyle treatment has not worked, and it's kind of should I say, advisable as a guideline that when people are in stage 2, stage 3, medications become first line of management. Lifestyle alone will not reduce their blood pressure significantly. So we talk about the various medications and obviously lifestyle management. And when we talk about lifestyle has to be all encompassing. So you have your diet, you have the physical activity, and you have management of stressful situations, and all other things that surrounds the patient. So it now becomes a holistic kind of management of the patient, with their family, input, and is knowing what's it that's actually happening in this person's life, rather than just the person alone. This is where everybody, and I think Bio and Tokes, they will do a good job with that the next lecture of this. So let me talk about medication. I say most people will need more than one medication, and that is a discussion that I love to have with my patient straight up, because sometimes some people will think, oh, why am I having 2 medication? Is it because my case is bad? Oh, Mr. So is only on 1 medication, so I have to be on 1 medication and all kind of things. Right from the word go, let the patient know, we let the patient know, most people will be on more than 1 medication. And as I said earlier on, decision on medication use will be based on the stage of the high blood pressure, with or without target organ damage. And now this is where, we come to our own, in that some researches has shown that the medications that are like first line for Africans and Afro-Caribbean is different for what is first line for Caucasians and Asian. So you need to have that discussion with your GP. And it's just because of the way we handle salt in our body and the way that our kidneys produces some particular enzymes and they work. So that's why some of these medications have been made first line for African and Afro-Caribbean. So for African and Afro-Caribbeans of whatever age, the first group of medication we start are what we call calcium channel blockers, or the diuretics, what we call thiazide-like diuretics. Calcium channel blockers, basically they work by blocking the influx of calcium into the muscle wall, because calcium is needed for contraction of the muscle wall. So the calcium channel blockers, they stop the interaction of the calcium with the muscle wall and allow the muscle wall to be relaxed, so that at least then the being relaxed and being more open allows the blood to flow easily. Why the diuretics, everybody is had, water tablet. That's what is called diuretics, So the water tablets, they allow, blood to flow, and also people to be able to pass urine easily and pass more water easily, so that their body don't get congested with the fluid. That's the first line. So that for some people, you can start them on the calcium channel blockers, things that ends up with pain. You might have a family member that's on amlodipine, nifedipine, nicardipine, all kind of pain. Those are the calcium channel blockers. If they cannot tolerate that, or if for some reason of their health they cannot use that, you can also give them thiazide-like diuretics. But if they are diabetics and you don't start with thiazide diuretics, so either or could be started for any African or Afro-Caribbean person. And the second line is, if you've started on, let's say, calcium channel blocker, and it's not controlling the blood pressure, you can add the thiazide-like diuretics to it, and vice versa. And the third line basically is what we call angiotensin receptor blocker, or angiotensin converting enzyme inhibitor. These are just chemicals and hormones in the body that affect the way the blood pressure or the blood vessels react, the tightness in the blood vessels, and so it increases the blood pressure. We say A2RB, that's the angiotensin receptor blocker, is preferred because of the all kind of side effects with the ACE inhibitor, and especially in this climate of COVID-19, one of the common side effects of ACE inhibitor is dry cough and chronic cough. So you can imagine, nobody really wants somebody coughing everywhere at the moment, and everybody start looking at you with the left eye to say what's going on, So that's why it's like, that's preferred. Then we have, if all those three is not working, then you can add a fourth one. But all the decisions about the medications, they are to be made with your GP, and it's better. Don't say because of my neighbor or my cousin is using this, I should be using that, and you go and get the medication from them, especially from, people from my country. We like that. Oh, please give me some of your medications. Please don't take medication or discourage your family member from just using a medication that is not prescribed for them, because they might have other medical issues that precludes the use of those other medications, but they just think, oh, because my next door neighbor is using this, I should also be able to use that. It doesn't work that way, especially with high blood pressure and the known complications. For whites or Caucasians and Asians, we use treatment based on age. If you are less than 55 years old, the patient is more likely to be started on the ACE inhibitor or A2RB, but if they are older than 55, they usually start with the calcium channel blocker and the thiazide diuretics. And then all the other medications can be added, to their treatment, as needed. Yes, I said compliance is the key. There's no point in having the medication and not using it. And this is quite common. Even we also, when you get some medication from your doctor, once you start feeling a bit better, you just leave the rest and you don't use it, And that is exactly what is called compliance is the key. Make sure if a relative is on a blood pressure medication, or if you're on a blood pressure medication, keep to it. Most of them, they are taking once a day. And so you can just set a kind of an alarm on your mobile phone and that will help you, to be able to say, oh, once a day, you remember, and just take the medication once a day, and also get your blood pressure monitored regularly with your GP. Okay, so we come to the managing stress and others. Let me see. Okay, I think I think I'm still good for time. Am I? Okay. All right. So when we say managing stress and others, I'm sure you guys can recognize that book, that says don't take the poison. If you don't recognize that book, I would, and the name is our host Olalunke Ashirugbadebo. That is a book. If you have not, purchased it, just go and buy it. It gives you a kind of advice on life issues and how to handle life issues, and you don't let something just keep bothering your mind and keep weighing you down and everything, because the more things weigh you down, or the more you allow things to just fester in your heart, in your mind, the more you are likely to react awkwardly to situation, to life, to you, other people, and you will be there hurting yourself, because your blood pressure will be going up and all the other parts of your body will be reacting to that, while that person might not even know, or that situation might have passed, but you are there. What if? So don't take the poison of, hate, unforgiveness, and all kind of things. Just let go. And once you let go, your body also then relax. What we call the sympathetic overdrive of your body then just goes, and your blood pressure will come down. And we have other things that's called meditation, yoga, breathing techniques. They are all ways that people use to keep their blood pressure down. Meditation, as Christian, Bible enjoins you to meditate constantly upon the word of God. And he also says, so if there is anything that is of good report, you should think of those things, not everything, other things. And the yoga practice and breathing techniques, they are all ways that people use to keep their blood pressure down. And then we come to other parts of lifestyle modification. If you smoke, stop smoking. Smoking is one of the most dangerous activity that people can do. It affects about every aspect of the human body negatively, and it's just not worth a habit worth taking up if you have not, and it's a habit worth stopping if you are practicing it. And it saves money when you stop smoking, and your clothes smells better also. Reduce or stop alcohol. If you take alcohol, there is a 14 units in a week that the government says for both male and female, and the 14 units is so small that majority of people don't even know what a unit is, So a lot of people that takes a pint of even weak beer, it's 1.5 units. Talk less of, people drinking strong beer or wine or all those spirits and everything. So reducing alcohol helps a lot to reduce the blood pressure and also to prevent hypertension from happening. Let's go. Okay, caffeinated products and all those fizzy drinks. A lot of people say, oh, I take decaf. I always tell them you don't have to use it, especially if you have some health problems. Then reduce or stopping caffeinated products, fizzy drinks, Coca-Cola or any cola drink, all those, or even fizzy, Lucozade, any fizzy drinks, energy drinks. Just cut them off, and you will be fine. Yes, weight loss. We can spend the whole day talking about weight loss, control of weight and everything, but it has a very important part to do in controlling and managing high blood pressure. It will be a total lifestyle change. And part of the lifestyle, it was what we talk about, the diet, and I'll just say there is what we call dietary approach to stop hypertension, what is called the DASH diet, and it's a diet that is full of fruits, fibers, vegetable, we say more of fruits, fibers, vegetables, fish, and poultry. And when you get the poultry, make sure you skin them. I know a lot of people think, the skin is where the sweetness is. Yes, but if you don't take the sweetness out of it, then you get into trouble with high blood pressure. So low fat, that means non-dairy milk, beans, peas, nuts, and all those pulses. You need more of them. I'll just kind of show you the dash plate over here, which you can Google it and you'll find all those advices about what constitutes dash plate. But I think maybe when Talks and Bio talk next week, they will do justice to that also. And we say less of salt. Cook with less of salt. Don't add salt on the table. It's your food will still taste sweet. Initially, when you decide to make the lifestyle changes of reducing salt in your diet, you might not enjoy the food, but gradually your taste bud will start adjusting to it, and your body will thank you for it because you will have a healthier lifestyle. Refined food, okay, over here, it might be difficult for most of us to do away with refined food, but just reduce it, because work and life happens, so reduce that, reduce red meat, and do more of poultry and fish. Some people have a discussion about open grazing meat or caged meat or red meat and everything. Whatever it is, if you can reduce the red meat contents in the body, it will help, in reducing high blood pressure. I just put that, because most of us, we have that big plate. Oh, nice looking plate, that is like, okay, the plate itself feeds two people. And someone like me, if that plate is in front of me, I really want to feel the edges of the plate, So can you just, if you suffer with high blood pressure or you have diabetes, hypercholesterolemia, that means excess fat in the body and things like that, just go and buy some small plates and use that to serve your food, because when the plate is big, it's just a kind of mentality, let me fill the plate up. So if you have a small plate, then you don't fill the plate up. Even if you fill it up, it will still be like half a plate. So that's what I meant by portion size. And of course, time to eat. Some of us, by virtue of your job, you will have to eat at odd hours of the day, but if you can avoid it, some people will say by 7 p.m., whatever you are eating, you should have ate your food and just be relaxing. If you cannot, then just be mindful. Next one, exercise. I say move. It will only make you feel better. If you don't move, you will not feel better. I mean, our host Talks and Bio, I'm sure they will be talking more about that next week. Please make sure you join them, and because it can only help you and it can only make you feel better. The advice is 30 minutes per day or 150 minutes per week of exercise that is of moderate intensity. What do we mean by moderate intensity? It's just an exercise that makes you sweaty, works your heart, that it makes you sweaty but not breathless. So these exercises, you can divide them, if you cannot find 30 minutes straight up in a day, you can divide them into a 3 portions of 10 minutes each. That helps you, before we used to say, oh, it has to be 30 minutes concerted, but now research has shown dividing it to 10 minutes of concerted exercise, it does help. And it will help you, when we say moderate intensity exercise that's like, okay, your maximum heart rate, if you have to do heavy exercise, about 40 to 60% of that maximum heart rate is what we call, moderate intensity. And we have various types of exercises: aerobic or anaerobic exercise, moderate exercise, vigorous exercise. And yeah, that's someone that you can all recognize. It's Mr. Abayomi. He's a keen runner. He does, exercise early in the morning. You will see him running, all on the street. If you can do that, fine. But I'm sure next week he will be telling you a bit more about what to do and how, if you are able to get to that championship level, I salute you. People like us, we are not in that level, but we also do our own. So various type of exercises, while you can do like biomabo, but there are other exercises that have been shown, to improve high blood pressure and to help in treating high blood pressure. Flexibility exercises. I saw some of Toke's video, addressing, being more flexible and everything. And I'm sure she will talk more about it, flexibility exercises. We have endurance exercises. Most of the aerobic exercises, they are endurance exercises. They train you how long you can do, moving the joints. We also call them dynamic exercise, where you move your joints, and then you have static exercises where you just hold like hand grips and everything, but moving joints, what is called the isotonic exercises, stretching or bending. But I'll leave that for them to talk about, next week. And also we have the strength or the system building exercises, the weight building and everything. They also add, into improvement in blood pressure. Okay. Oh, I think I finished. I'm sure people might be wondering, no. So I just said a summary. I said, know yourself and your family background. This is quite important. If you don't take much from this talk, now this summary slide, I want you to look at it properly. Know yourself and your family background. If you come with a family that's maybe one person, one of your parents, or two of your parents, or an uncle, or if you are a twin and you have a brother, or even some of your siblings, if they have problem with high blood pressure, diabetes, hypercholesterolemia, or any health challenges at all, you need to look after your own health. You need to really, really be careful about your lifestyle, in order to prevent, the development of any of those challenges. So by knowing yourself, you know what you can eat, what you cannot eat, what you can drink and what you cannot drink, and what lifestyle you are able to follow or you should not follow. So know yourself and your family background. I said, prevent hypertension by healthy living. If you can institute those healthy living or healthy lifestyle, it keeps, high blood pressure away. And even if there is a familial predisposition to it, by instituting a healthy lifestyle, you actually keep it away. And I say you can beat it by dashing. That means the diet, against hypertension, diet approach, to stop hypertension. That's DASHINE, or dashing. That means doing exercise, doing some work and everything. It helps to prevent high blood pressure, and your medications. If you end up having to go on medications for high blood pressure, it is not end of the road. But make sure it is what is tailored to you. You don't use other people's medication just because, oh yeah, it's the same problem we have. You don't have the same problem. You don't have the same body. They most likely have other issues that as a kind of tailored and modified the reason why they are on the treatment they have. So you use the medication that is tailored for you, discuss with your doctor so that a management can be found for you, patient-centered management, and you'll be fine, you know. Oh, yes. I just thought I should put that one there, that we doctors, we are your friend. Don't run away from us, and it's not only when you get into trouble that you should come, give your doctor a call, pay us a visit. We will love to hear from you and help you to live a better and a healthy life. And always look after number one. And we're there also to help you to look after number one, and I think that should be me. Yep. That's all.
Thank you so much, Dr. Ajay. We would like to stop your screen share now. Okay. All right. Thank you so much. That was loaded. So much information really to listen to again and to think over. I noticed that during the presentation, one of our participants here raised her hand, and I think maybe she has a question to ask you. So if you can unmute yourself, please, and ask your question. Let me see if she's still here. Let me ask her to unmute, and can you ask your question, please?
All right, good afternoon, everyone. Thank you very much. That was very enlightening. I just want to find out, I'm on high blood pressure medication, but sometimes I get overwhelmed and all that. I forget to take my medications at times. Does that have any implications?
Yes, yes, we know life happens, and so sometimes you get rushing about and everything. And what I tend to tell my patient is that, okay, look at your lifestyle. When do you think you can consistently take these medications? If you are one that work shift, or you have kids that go to school, young kids that you have to get dressed up in the morning and everything, most likely morning time might not be the best time for you to take your blood pressure medication, because you will be rushing around and you forget. So you might want to scale it or schedule it for later in the day, later in the evening, and all those things, because most of these medications, they work 24 hours and then their effects, in the body kind of wear out. So we tend to say, please, if you can, find a specific time to take the medication, please do. And that's what I was talking about, compliance, and also setting up an alarm. Just kind of set an alarm on your mobile phone that reminds you that you need to take this medication, because soon you forget one day, and then because you don't have any effect on it, you forget for 2 days. It doesn't show you on you forget for 3 days, and then the next thing is like, oh, I've not even taken my medication for some days, and then the blood pressure gradually creeps up. And one thing that we doctors don't like is, okay, we are treating you, but we don't know whether you are taking your medication. And there's no point in being given a medication, that is not working for you, and it's not working because it's not being used. So please, my sister, try to find a way to take it regularly. If you can just set an alarm on your mobile phone, and then if it's night or evening time, your lifestyle is more consistent, just take it on the evening time, every day. It will still be effective.
Okay.
Thank you.
Yeah, you're welcome.
All right. Okay. I have two questions here. The
Mhm.
first one, how much is too much when it comes to exercise and for people that have hypertension? We've heard of cases of people working out in the gym and they just collapse.
Okay.
So how much is too much as a doctor? How much is too much?
Okay, there's no straightforward answer to that question. And one thing that I forgot to mention, okay, was that when someone has stage 3 hypertension, that means 180 over 120. And if you want to go into the gym, even when we say stage 2, between hypertension, and you want to go to the gym, you want to start some concerted gym work and exercise, you need to sit down at the gym and also with your doctor and get a proper advice before you start those kind of concerted gym work. Most of the other exercise, you don't necessarily have to contact your doctor. So if you want to start walking around the block as a start, or start a gentle jog around the block as a start, you don't need to contact your doctor. But if your blood pressure is above, the 180 over 120 group, then you need to sit down with your doctor and discuss your exercise plan, and your doctor might actually then be able to refer you to the gym so that they can have a tailored exercise, structured exercise for you. Because when you first start exercising, especially going to the gym, your blood pressure is going to go up. So because at the initial stage, the blood pressure goes up, so that could cause problem if it is not a tailored exercise for you, knowing your medical illness. So that's why when you go to some gym, they will tell you to fill out your medical history. And some gym will actually have some doctors there who will look at those things that you have filled out, and then they will be able to get you a tailored exercise. So that is much more advisable if you want to pick up exercise at the gym, and it does help you. So answer is there is nothing like too much, but the amount of time you have decides and it determines what you do. But most people, by the time you spend 30 minutes to 1 hour at the gym, unless you're an elite athlete, where your lifestyle is sports. Most people, 30 minutes to 1 hour at the gym, it's adequate enough for you to do what you want to do, because the recommendation, we say 30 minutes of moderate intensity exercise every day, or 15 minutes of vigorous exercise every day, for 5 days in a week, or 150 minutes in a week, is adequate for most people. If you want to go higher than that, don't go more than twice of that in a week, and they will be fine. But so there's no cap really, but the advice is 30 minutes a day or 150 minutes a week as a standard. So if you can maintain that, you'll be fine. If you want to go higher, but not way too high.
Okay. And the second question is about medication.
Mm.
For I've heard that once you are on medication, that you'll be on it for life. Is it possible for your GP to start you out on medication? Then once your blood pressure is regularized and you're already putting lifestyle changes in place for you to be taken off the medication?
Yes, is the answer. You can be taking off the medication. And that's where the monitoring or the regular review of medication comes in. So we monitor patients some will be monitored every 3 months initially, some every 6 months, some every year, depending on how they are stable. Obviously, depending on what is caused the high blood pressure or what sorts of damage it's done in the body. If it's one without the target organ damage, most people, they are able to actually reduce their medication and come off. And we have lots of patients like that. And by the way, we used to have, this is just a aside, because high blood pressure has a twin brother, which is diabetes. We used to say, okay, once you have diabetes, you never get cured. But now we have loads of patients that we called cured or recovered diabetes because lifestyle, when Tokes was starting, she was talking about there's a lot of information there, and we are in an age of technology and information and everything, and researches are being done in order to make sure that we don't have to stay on the medication. So a lot of people are coming off their diabetics medication by their lifestyle changes, and also their high blood pressure medication by lifestyle changes. But it has to be a consistent lifestyle change that makes sure that your blood pressure stays low to a level that your doctor will be happy with, and then you get monitored. Yes, you can come off. It's not a lifetime sentence, as I said.
Okay. All right. Mr. Bayo, yes. I don't know whether you like to, for people that have been able to join us today, just to say a few things on exercise and hypertension. Like one of the things that questions have been asked over the years as a fitness instructor, especially among the Black community, is the fear that once you have hypertension, it's like people have the impression that hypertension and exercise are not compatible. And you have to do a lot of explanation, like maybe they've had cases of people maybe during the time of the workout, as I mentioned earlier on, maybe they collapse or something happens, or they leave their house to go and jog and something happens to them on the road. So there's that underlying fear. So what information can we give out there to allay the heart of people that, you know what, having hypertension is not a death sentence. You can still live a good life. So especially as it applies to exercise.
Yeah, I think the mistake most people make when they start a life of fitness is they take on too much too soon. So as a general rule, whether they have high blood pressure or not, if you're someone who's never really been doing exercise, or someone who's excuse me, or someone who's stopped doing exercise for a while, you never go back into doing exercise by taking on too much too soon. So for example, I do ultra marathons regularly. I do high mileages, run at a very fast pace, and I do so many different exercises. I wouldn't recommend that for somebody who's just starting off. I think Dr. Ajigini did make a suggestion, which I was nodding to, which is most people when they start exercise, they should start with very, very mild exercise, like brisk walking, for example. I mean, you don't need to be an elite athlete. You don't need to be running 20 miles or 15 miles for you to be fit. That's another level, which you build up that even over the years. I've built up my endurance to be able to run ultra marathons and marathons over so many years of running. And I didn't start off with those high mileages. I started off with very low mileages, and then gradually started to build it up. So if someone's got high blood pressure or hypertension and they want to start doing some form of exercise, what they really need to do is start off slow. So I would not even recommend running. I'd recommend brisk walking. Even I was talking to a potential client last week, and I was saying to the person, I said, don't even think about brisk walking for 20 or 30 minutes. Start off with 5 minutes of brisk walking, get into a routine, and then from then you can increase it to 10 minutes, and then from then 20 minutes, and then 30 minutes. Like Dr. Ajigini has just recommended that, we need to do 30 minutes of exercise. Even that, I wouldn't just start off with 30 minutes of exercise. I would start off building it up gradually, like maybe 5 minutes, because your joints, your muscles, your heart, your lungs need to start getting used to doing all this exercise, which they've never done before. And to ensure that it becomes a lifestyle change and not just a momentum, a brief momentum or brief period of excitement where you get into exercise, it's better to start off slowly and build it up. And then that way it becomes a lifestyle change. Once you become used to it and you're now doing the 5 minutes every Monday, every Monday at 6 o'clock or 7 o'clock, whatever time suits you. You're doing your 5 minutes. When you've done that consistently for two weeks or 3 weeks, then you ramp it up to 10 minutes. Then once you've done that consistently for another 3 weeks, then you can choose another day and say, right, I'm doing 10 minutes on Monday and do 10 minutes on Friday. And then gradually start increasing the number of minutes you spend per day and the number of days you spend per week. And if you do that, there is no way you're going to have any problems, even if you got high blood pressure, because you're gradually conditioning your heart and your lungs to be able to take on exercise. So they grow with it, they grow with you and they grow with it and they get stronger. So you would not have, you're not likely to have problems. But I always say to my clients or potential clients, I always say, before you sign on to this program, visit your GP and just get a general checkup before you start. And then when they start, depending on where they're at, I always start most of my clients with brisk walking and a little bit of strength exercise, so we get that balance. So if you got high blood pressure, for example, and you want to, as recommended by Dr. Ajigini, which is the best, he's a doctor, so that is the best recommendation. Start slow. I would start with brisk walking, something that's not too intense, and then basically builds up from there. And if you have a personal coach will keep an eye on. I have a client, for example, who did have some problems when he started running, because we had been brisk walking for a while and introduced him to running, had a little bit of a problem. Obviously, I always get feedback from it. I said to him, stop the running, keep on with your brisk walking. And I said, go straight to your GP and get a checkup before we go back to the running, and which he did. So your personal trainer is the best person to actually help you if you're not sure about things like that. But as a general rule, start off with brisk walking, 5-10 minutes, get into a routine of doing it every week, specific day every week, and then just build it up gradually from there.
Okay.
Let me just,
Thank you.
yeah. I mean,
okay.
look,
Right.
I typed something in there, and it's like, okay, fine. Even for elite athletes, while everyone is coming out of lockdown, what we're saying is we have to modify and gradually build them up.
Yes,
because everybody's been home and your body becomes so deconditioned, so soon and everything. So to come back, even as an elite athlete, you have to gradually build them up again, So as Bayo was saying, yes, start slow, and then build up.
Okay. During your presentation, you said that for stage 1 and stage 2 hypertension, lifestyle changes can be put in place to control it. Would the same advice go to people that have other health conditions? Like maybe somebody has high cholesterol level and they have maybe diabetes and they also have hypertension. Will you advise that they still go with lifestyle changes instead of taking medication?
No. And that's why I talked about the target organ damage. The presence of diabetes, changes, and also hypercholesterolemia and high blood pressure, it changes the picture completely. Because those three together, there's something we call metabolic syndrome, which is like, okay, once that is on board, and stage 1 high blood pressure, definitely there will be target damage if someone is diabetic, or has high cholesterol. So diet and lifestyle alone might not work for them. Type 2 or stage 2 high blood pressure, diet and lifestyle alone in the presence of diabetes and hypercholesterolemia, with high blood pressure. Those are kind of 3 heavyweights, that the person is trying to battle alone. So we do have to support them with medication. so that even if because the kidney is not going to function well, the brain, the other organs in the body are not going to function well in the presence of diabetes, hypercholesterolemia, and high blood pressure. So we tend to advise that, okay, for those ones, they can start with medication in addition to their lifestyle, or they should actually start with medication in addition to the lifestyle changes, and some of these things can then be dropped off along the way, once you start improving the lifestyle, because they're just going to get overwhelmed, by what is being asked of them, with lifestyle changes that have to be put in place in order to bring, because the blood pressure level that is safe for a diabetic patient is actually lower, than what is normal for the other population. So that when we are controlling their blood pressure, what is expected of them, their value is lower than the normal value that we have for the other people, and also their cholesterol level, what is expected. Why we will say, okay, for most people, cholesterol above 4, 5 is okay. For diabetes, your cholesterol total cholesterol has to be under 4. So now having to institute that lifestyle and also having to watch diabetes and all the, they will not be able to sustain it. So that's why we always have to start those kind of people on medication, because invariably they will have what we call the end organ damage or target organ damage. And that is a reason for starting medication.
Okay. The next question is about dieting and managing hypertension. I know you spoke earlier about dietary guidelines that we can put in place to help us to manage hypertension. But I also know that there are a lot of diet programs out there, especially people that are overweight and they want to lose weight, quickly, that they embark on different kind of crash diet programs for them to be able to lose weight within a short time. So will you recommend that kind of dietary approach to managing hypertension, even if the person is active, even if
No,
the person exercises regularly?
no is my answer to that. I am one of these people, I believe in you clash in, you clash out. So if you are trying to clash a diet and everything, you're going to clash out and you're going to do more harm than damage. And I mean, the good thing in the developed world, you have a lot of things that are available for you by sitting down with a professional. Bayo was talking about, when you want to pick up all those ultra exercises and everything, it's better for you to sit down with someone like him, have a personal trainer, you sit down and design something that is long standing and long lasting. And that's what will yield a persistent result. If you clash diet, you're going to clash out and you're going to pile up again. And that even does more damage to the body than a consistent process. So as a GP, when a patient comes to you and say, okay, I want to lose weight, I want to this and everything, you sit down, you do their blood test, you do their blood pressure, you measure their weight and everything. And then there are a lot of things the government has put in place with their blood test, blood pressure, and their blood weight. You can refer them on, to programs like what we call healthy living lifestyle, exercise for healthy living, weight for healthy living and everything. And these people will sit down with you and design, a management that will suit you and you can work with, and also, taking into consideration all the health conditions you have. So I don't recommend keto this or Atkins that or this and that. I don't. If someone is not even overweight and just want to do, I recommend balanced diet, because balanced diet supplies you with everything, Atkins did keto that and everything. People tend to clash out of them, and it just mess up their, other parts of their system.
Okay, and the last question I have with me here has to do with effect of aging on the risk of developing hypertension.
Yeah. So, as I said earlier, the problem with aging is that, okay, as we age, the tube, which is our blood vessels, become less pliant. So the walls become more and more calcified, and that's where the calcium channel blockers and the calcium comes in. The calcium gets deposited into the wall of the blood vessels, so they become less pliant, and so they don't expand when they should expand to supply to allow more blood to flow through and things like that. So as we age, that elasticity is lost. You will feel it on your skin don't bounce back anymore. So same thing is happening inside, but instead of being loose, it's being hard, and so things become hard, and so they don't open up more. And so that means the pressure that the heart has to pump against is increased. And that's why as people age, they have increased blood pressure. And that's one of those things that, okay, you can't change. We all hope to age, and become old. So you just have to change your lifestyle in understanding that. I'm sure most of us, we do know what we were able to, or those of above 40 years, the way you used to recover after eating something or after doing something, you don't recover like that anymore. So it's a matter of life. So yes, aging leads to increase in the stiffness of the blood vessels, and that's what leads to those high blood pressure.
Okay. I don't know if any other person in the house has any questions.
Yes, I have one.
Okay.
Actually, I have a couple of questions for Dr. Jigini. So, what is the correlation between blood pressure and heart rate?
Okay. Okay. What we tend to, when we're defining blood pressure, we have what we call stroke volume, which is the amount that your heart pumps out, and we multiply it by the number of times the heart beats, and that's what's called heart rate. So and we like a certain volume in a minute, what we call 5 liters and all those things. But so we tend to say the usual heart rate or the normal heart rate, the range is between 60 to 100.
Yeah.
Okay. If you are ultra athlete, marathon, spirit runner, and all those things, your heart rate can be as low as 40 because of training. Okay.
Yes.
But for people like me, if I get heart rate of 40, I will just be sitting down. I can't do anything, So we say between 60 and 90 is the optimum heart rate, because when the heart contracts, each time it pumps out about 72, So we tend to say 72 to 100. So we tend to say, okay, so the pumping of the heart times the heart rate is what gives us the blood pressure. So with that, and that's where the heart rate comes in, and some situations whereby when you stand up, the blood pressure drops, what we call postural hypotension, because the blood pressure goes to the leg, and because the muscles of the leg or muscles of the body are not in a tone to pump the blood pressure. What the heart will have to do was to increase its beating, So for people with postural hypotension, when they stand up, they will notice that their heart rate is going to increase, because the should I say, the dynamics and the equilibrium has to be maintained. The heart, we want to maintain that, so it's going to pump so fast. And also when you start running, because you have vasodilation, the blood vessels open up, the heart has to pump quite fast to maintain the blood pressure. And that's what increases your heart rate when you are running, because the heart then now has to pump fast, boom, 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 to make sure that you are getting blood, because you cannot increase the volume. There is a specific amount of volume that it can pump out. The only way you can maintain the blood pressure is increasing the heart rate. And that's what happened also with the blood pressure. So if heart rate increases and the stroke volume is maintained, the blood pressure is going to go high. If heart rate drops and stroke volume is maintained, the blood pressure is going to drop, and, so that, I hope that answers the question.
Yeah, it does. And the second question I wanted to ask is you mentioned something about calcium deposits in the blood vessels.
Yeah.
So my question is, what causes calcium deposits in the blood vessels?
Okay. I mean, calcium is one of the, should I say, commonest elements in our body. And thanks to vitamin D, vitamin D is now receiving a rave review. Vitamin D is important for almost everything in the body nowadays, so everybody knows that. So if you don't take vitamin D, take one a day, it helps, So, but the way the body repairs and the way the body does things is inside every cell in the body, there are what we call calcium channel receptors. And as we get older, the lining of the blood vessels might be damaged, then the calcium gets deposited there. If there is a bleeding anywhere in the body, the calcium gets deposited there. If you break your bone, the bone comes together initially as gel, there's a gel formed in between the bone ends, and then what the body does is it sends calcium there, calcium deposits there, and the calcium makes it to become hard, and then it forms bone, what we call calcification. So invariably, anywhere there's a damage in the body, one of the repair that is sent by the body is calcium. Because the calcium meant to repair, and it just makes things hard. The body doesn't know it's doing you a harm by doing that. The body is just trying to repair itself. So as you get old, where elasticity is lost and everything just opens up, the body has to find a way of maintaining the rigidity of the body, and that's where you get calcium being deposited in various places of the body. And, as we get old, calcium gets deposited everywhere. Our joints get grinding and calcium gets deposited, your back, your muscle, everywhere, So it's just it's a normal thing with life. It's a normal aging process. It's not a bad thing, but it's when we don't maintain the other part of our lifestyle that it becomes a source of problem. Is that okay?
Is that all? Hello, Mr. Bayo. I think we're losing.
I'm sure it's not gone running.
I'm here.
Okay.
Okay. Is that all? Is that all?
Yeah, that's it. Thank you so much. Thank you. Yeah.
Okay.
Yeah.
Okay. I don't know if any other person has any question in the house. Okay. So your final word, Dr. Ajigini, as we round up.
Yeah. Okay. I mean, thanks, Stokes. Thanks, Bayo, for the work that you guys are doing. And thanks to everyone who have joined, whether on Zoom, online, on Facebook, or YouTube and everything. My guess is because you guys are interested in seeing how you can improve your health or the health of your relative. That's why you've tuned into such a program like this, and so I really appreciate you, and thanks for your time. If you don't take anything from this, one thing, as I said in the summary slide, know yourself, know your family background, and that will guide you to institute a lifestyle that will prevent most of these conditions, as Tok said at the start. We don't have to get them. We don't have to. There are lots of information everywhere, and luckily for us, some of us live in the Western world. Even if you live back home, the information is still filtering back home, and you can always enjoy your lifestyle and assume a positive lifestyle, that will help you to prevent, we will love prevention rather than cure. So, but even if you have to get to the stage of being needing treatment, it is not a life sentence. it is something that, yes, you can start the treatment, work with your doctor, work with your, if it's a trainer you have, if it's anybody that you have that you can work with, and there is a consistent maintenance of a healthy lifestyle helps to prevent, and also if you're on treatment, comply with your medications, and we can all beat this. Any further questions or queries you can send to Kumbo, and she will forward to me. And yeah, thanks for allowing me to do this. I really appreciate it.
Thank you so much. We're grateful for, I know you're a very busy man, so it's really an honor being able to get you here today. This is just the first part of this program. The second one is next week, Saturday, and it will be anchored by myself and our fitness, my own fitness trainer, really, Mr. Abayomi, and we'll be talking talking more about the role of exercise in prevention and management of hypertension. And in closing, I'd just like to say, just what the doctor said, man, know thyself. Self-care is not selfishness. Know your threshold, know your limit. Know the things that increases stress. As he said, one of the things that causes hypertension is unmanaged stress. And as individual, our stress threshold is different. So if you know that there are certain issues in life that are becoming too much, just dissociate yourself with it. No, because one thing about health challenge is that once you open door for one, and if you don't manage it on time, it just opened other doors, just open more doors for other health challenges to occur. And it affects the quality of life. Once the time you're supposed to be using to do other things, you might find that you are being distracted and you're using it to manage your health. So self-care is not selfishness, because if you are not okay, you will not be able to function well. So it's not just so in this context we are talking about hypertension, but I'm passionate about holistic health. I'm passionate about people looking after themselves, spirit, soul, and body. But at the end of the day, it's an individual journey. Know yourself, know what works for you, understand your family background, their health challenges, the things that you can easily be predisposed to. And at an early time, begin to put things in place that can help you. And at the same time, know what works for you. Know the kind of eating program that works for you. And just as they have said, I really love that statement. Man, know thyself. When it comes to self-care, it is an individual journey. The principles of healthy living, they are general, they are universal, but its application is specific to individual. So I just want us to go with that. So maybe some of us, we need to review our eating habit. Some of us that don't like exercising, we might need to start taking baby steps and find out what do you like. Even if it's just to dance, please dance. It's still a form of physical activity. At the end of the day, look after yourself. Nobody is going to do it for you. If you don't look after yourself, nobody will do it. And if anything happens to your health, you are still the one that is going to face the consequence. So please and please know yourself and know what works for you. Thank you so much for those that have joined us on Zoom. We appreciate your involvement. And for those that have also joined us via Facebook and also Zoom, thank you very much. Share it with people that you think we need it. We need you here on earth. Your contribution on earth here is very, very important. And for you to be able to achieve your purpose here on earth, you need sound health. And that is why this kind of program comes our way to remind us that in the process of doing other things, let's not forget our health. Thank you so much for joining. We'll be back next week to talk about what I'm very passionate about. Some people call it jumpology. I don't know what Bayo calls it. Bayo, what name do you call it?
Healthy lifestyle.
Healthy lifestyle. So we'll be back next week to do justice to everything that has to do with jumping up and down and getting your body to move. Thank you so much again for joining us, and we'll be back again next week. Bye for now.
Thank you.
Thank
Bye-bye.
you.
Thank you.
All right. Bye.
Bye.
Okay.